Hello, and welcome to the presentation on the partial weight bearing protocol. The purpose of this presentation is to go into further detail on how we progress your weight after being non-weight bearing for a lengthy period of time. The reasoning for transitioning your weight slowly over time is to prevent setbacks. For example, from not putting weight on the foot and ankle for so long, not only do your muscles get weak, but so do your bones. If you progress too quickly on these weak bones, they do not have time to strengthen up and form little cracks within the bones themselves. These are called stress fractures. Therefore, the goal is to make slow and steady progress without such setbacks and get you back on your feet as safely as possible. Also, please note that at this point, moving forward, the boot only needs to be worn when moving around. You may have the boot off when not up and about, such as when watching TV or eating. You also do not need to sleep with the boot at night any longer. It is still a good idea to keep the foot elevated on a chair when you can. Let us proceed with the presentation. This table represents a guide on how to transition your weight in the walking boot over the next 4 weeks. The next slide will talk about ways to accomplish this. You can also practice this with your physical therapist. The take-home points, however, are that these body percentages are rough estimates. It is also important to know that although we will let you progressively increase the amount of weight you put on your operative foot or ankle, we do not want you spending more than a total sum of 2 hours a day actually putting weight on the foot. This is usually broken down into 5 to 10 minute intervals. This is also not meant as an exercise as much as just building this into your daily routine. For example, when going from room to room throughout the house, you may put some weight on your foot with the use of crutches. You may also put weight on the foot for other short distances, such as getting to and from a car. If you are going to spend any lengthy amounts of time moving around, it is better to keep weight off of the foot, either with the use of your crutches or other ambulatory aids, such as your knee walker. Again, the purpose of this protocol is to allow the foot and ankle to continue to strengthen up without any setbacks. This next slide describes how to measure each percentage of body weight on the leg by using a scale and either crutches or a regular walker. The idea is to get a sense of what each body weight percentage feels like on your operative side as you progress each week. For the first week, you will measure 25% of your body weight on the leg, followed by 50% of your body weight on the leg the following week, and so on and so forth. Again, this is all done with the walking boot. If it is too hard to use a scale, another way of thinking about this is doing less than half of your body weight the first week, which is essentially just resting your foot on the floor. For the second week, an accurate way of measuring half of your body weight is to stand with both feet on the ground with equal weight. By doing this, each leg is bearing 50% of your body weight. The idea then is to use this as a guide of what it feels like and not to put more than half of your weight on the foot when walking, using your crutches or walker to offload the other half. The third week, you would do most of your weight, and finally bearing all of your weight the fourth week. During the fourth week, you should also begin to transition off of the crutches. Most people go down to either one crutch or a cane. This is also when we will let you formally walk up and down stairs. In terms of driving, if your surgery was done on your non-driving foot, we will let you begin driving the first week of your weight progression. If your surgery was done on the right side, however, you must wait at least until the fourth week during the progression, which is when you will start to put full weight on the foot in the boot. Studies show that your reaction time from going from the gas pedal to the brake pedal in an emergency situation does not return to near normal limits until this point. You would also have to use your boot to get to and from a car and then switch to a sneaker. In terms of flying, you may begin to fly once you are fully weight bearing during the fourth week. Now that you have completed a whole week of full weight bearing in the boot, you may begin to transition out of the boot and into a sneaker. This is done over a 2-week time frame. The idea is that you spend each day more in your sneaker and less in your boot than you did the day before. Space this out so that over the 2 weeks, you are completely out of the boot and in a sneaker. A good way to do this would be to make the transition over the first week simply at home and then begin to transition into a sneaker outdoors over the second week. Again, as a final point, remember that throughout this whole process of transitioning your weight, you do not need to sleep with the boot.